We're now joined by Rahab Mwaniki, Campaigns Manager, Kenya AIDS NGOs Consortium, to discuss this. Hello, Rahab.
Hi, thank you so much for hosting me.
All right. The World Immunization Week ended this week, and Africa is still clearly lagging behind when it comes to COVID-19 vaccination, with Africa recording only 1.3% against the 44% in other countries of other continents. What exactly would you say the problem is?
It's one basic thing we are talking about is the issue of equity. What we are having is higher income countries are having what we call nationalism of vaccines, such that they have given a lot of money to manufacturing companies that are producing COVID-19 vaccine that at the moment they are having 5 times the doses they need. Yet Africa, we do not have enough doses. So it's going back to where we're saying there's lack of equity in access to technologies, in access to vaccine, and in access to diagnostic tools. The other thing is that African governments have not invested enough in health R&D. When we look at the African Union, there is progress right now to have public-private engagements with pharmaceuticals like Johnson & Johnson, and we are hoping that with this, with the transfer of knowledge, then we are going to have access to vaccines, the tools we need, and health and other diagnostic tools. Just to mention that Africa consumes a quarter of the doses in the world, yet we do not even have enough capacity to produce routine immunization for polio, for diphtheria, for tetanus. We always have to get donations. And that's something as Africans we need to look at and stop getting donations and build our own manufacturing companies in Africa.
All right, I was going to ask you solutions, but apparently you've got into that. But let's talk about creating awareness on the need for Africans to get vaccinated. What measures would you think African governments can adopt to get around this?
I think one of the things is civil society play a very key role. We are the people who live with the community and the people and the citizens in our country. It's very easy for us to convince mothers to bring children for immunization. The other thing is right now people are saying COVID-19 is laced with poison and all that. I think there's need to do more of mass awareness, but create partnerships with civil society organizations in every African government or state or country we are talking about. And then we also need to break down this language of science that normal citizens can be able to understand the issue of vaccines and how they work. And that's how we need to borrow from the HIV pandemic. That's how HIV, we were able to move forward and progress to a point that the issue of mortality went down.
Let's come back to the issue of COVID-19. Do you think there's been enough research into the development of a homegrown vaccine that will be available and accessible readily across Africa to tackle the pandemic?
Well, interestingly, if you look at even investment for health R&D, it's very minimal for African governments. Right now, we only have 5 countries in the whole of Africa. That's Egypt, Morocco, Senegal, South Africa, and one other country who are poised to be putting up manufacturing plants for vaccines. But even with that, we need to have governments waiver the setting up of machines. We also need to have the big brothers, you're talking about the big pharmaceuticals, transfer knowledge. Because we are in a point where we are saying if we are not immunized, nobody's safe. For us, as Africa, we have 1.3 billion population. We need to have 60% of the population immunized for us to have what we call herd immunity. Without that, we will still have COVID-19 coming back, destroying our economy, and all other issues that is wreaking havoc in Africa.
All right, thank you, Rahab. Thank you for coming on today.
Thank you.